I think sometimes we forget that those strong ones, the ones that look, they've got it all together, they're doing it, are perhaps the ones that are least likely to seek out help.
It wasn't like I woke up one day just out of the blue and was like, I'm going to kill myself today.
What we know about most times that people become suicidal, it's in the presence of a mental health problem, a mental illness. So there's an existing mental illness, and then on top of that, there is a life crisis. So that could be a relationship breakup, or it could be some kind of a problem in the workplace. We want to be able to prevent those cases that don't happen so often but are very, very tragic.
Suite à une séparation avec ma conjointe, je suis tombé dans une profonde dépression. J'ai eu des problèmes de dépendance au jeu, à l'alcool. Ça a influencé vraiment toute mon estime de moi. J'avais de la misère à entrer travailler. Ça a occasionné beaucoup de querelles avec mes collègues de travail. J'étais devenu un monstre, une personne en colère tout le temps, puis ça venait vraiment difficile, les relations interpersonnelles avec tout le monde.
You know, I'm not even sure what caused it. I mean, I've got diagnosis of post-traumatic stress. I can see it, I can't. It's not like I'm in denial. I am the way I am. It wasn't even that I ever wanted to kill myself. I just, for some reason, couldn't get it out of my head. I had like 40, 50, 60 times a day sometimes, just mental images and urges to throw myself off a bridge or plunge a knife into my arm.
Un vendredi matin comme ça que je suis rentré vraiment trop magané de la veille, j'ai été pris en charge dans le fond par ma chaîne à commandement. Ils m'ont donné vraiment un bon coup de main. Je savais même plus prendre une décision par moi-même. Alors j'ai été escorté à l'hôpital.
Intrusive thoughts that would compel me to do something. And obviously I had resisted. I don't know if that was from medication help or from hanging out with my dogs or whatever, but that's how it kind of surfaced in me. It's not like I was sitting in my bedroom writing poetry and setting out a noose.
My name is Bonnie Rushwick, and I live here in Saskatchewan, and I'm talking about our son Patrick. Patrick was a captain in the armed forces. He was in our engineers. He was our middle child, our second son. Not so little boy. He was about 6'6" with a grin to match. Patrick was in the armed forces for 10 years, always interested in it. And he had been in Army Cadets, I'd been in Scouts. He joined up right before he graduated from grade 12. He went to the Royal Military College. He served in Haiti. He called us a few times, and his biggest stories were about the size of the bugs. I couldn't get over that. They're Godzillas out here, Mom. They're Godzillas. June 2013. June 11th, Patrick had some very horrible news. He was married. Some things happened that were really, really just hit him very suddenly. And we lost him.
Patrick was a really good friend of mine, a neighbor, and basically a brother. We were sitting in his garage. He had got some bad news, and we spent the whole night together discussing everything. He was drinking, I wasn't. I had an exam, and I was just trying to, focus his attentions where he needed to and get him calmed down, tell him everything was okay. I don't know if he did this to try hurt someone, but The only people he hurt were the people that loved him.
There would have been so many ways we could have helped him. I think as a mom, that was my hardest. I had no chance to help him.
I feel that just given time, he just made a very rash decision. Most likely on a good mend, on a good road, given the right time and the right people and the right help, and just support. It was rough, but I've seen a lot of people go through what he was going through.
When a suicide occurs, the devastation of the people around the person who suicided. People will ask themselves, did I miss something?
Looking back at it, I'm quite the overthinker, so I've processed this over and over as to what I could have done. Is there anything I could have done differently?
Je crois que le grand défi ici, c'est surtout peut-être le désespoir de ne pas voir une lumière au bout du tunnel. Et c'est d'essayer de peut-être mieux connecter avec l'individu pour lui montrer qu'il y a certainement d'autres options.
When a person attempts suicide, is you get this more impulsive coming together of all these factors, and therefore it's a temporary state. So if that person gets, especially if they get the help they need, their symptoms are decreased, their likelihood is that they're going to get over those suicidal thoughts. In fact, that's what happens in treatment.
It's just a compulsion, and it doesn't make sense. I mean, nothing about suicide is logical. Our bodies are not wired for self-destruction. They're wired for self-preservation. And when you get those urges, it's kind of like a cross-wiring in your head, and you're thinking one thing, but you're feeling another.
I don't know. It's hard to even put words onto it. I know he didn't want to do that to them, and he sure as hell, whatever he was thinking, like the professionals say, he just wanted to make things easier for people. He sure as hell didn't. He made them a hell of a lot worse. What he did, if he could come walking through my front door right now, first thing I would do would give him a huge hug. Second thing I'd do was knock him the hell out.
It's difficult. It's hard when horrible things happen. And when they're in your mind, when they're in your heart, it's difficult to share with others. You're not sure that others can understand. Nobody can claim to know exactly what's in your heart, but we can be there for you. It doesn't have to be anything formal. It doesn't have to be a mental health counselor. It doesn't have to be, it has to be somebody that you can trust.
Souvent, on a l'opportunité de pouvoir en parler, de pouvoir identifier soi-même les risques pour nous, pour les autres, et peut-être d'intervenir.
J'ai pu rencontrer les médecins qui m'ont ensuite dirigé vers une thérapie où j'ai pu prendre soin de moi. Thérapie qui a duré 28 jours.
When they asked me honestly, are you going to kill yourself? I would answer honestly, and I was like, no, I'm not, but I can't get it out of my head. And I had set an agreement with my doctor that if it ever came time that I was going to, say, jump off a bridge, that instead of jumping off the bridge, I would just get on the phone and call 911. And my coworkers at the time were very supportive, especially my leadership, my CO and my sergeant major. They knew that I was having significant problems with mental health, and they didn't have to make a lot of accommodations, but they were willing to, and they were upfront about it.
One of the things about the military population that I learned very early was we have a very stoic group of people working in the military. You know, that sense of stoicism, and I should be able to help myself, and maybe this problem isn't worth bothering people about. So one of the things I want to say, in fact, to people is that there is no problem that is too small.
Laquelle j'ai repris vraiment le goût de vivre, j'ai pu travailler sur moi. Puis aujourd'hui, ça fait 3 ans, puis je suis présentement tout réhabilité. Je suis revenu dans mon poste.
I took a very proactive approach towards my therapy. I took it really seriously. I tried to get the most out of it as I could. It wasn't just, I'm attending because I have to attend, and this guy, he won't understand me. It's like, if he doesn't understand me, I'm going to keep talking until he does understand me. And with the suicidal thoughts, I'm going to keep talking until he gets what I'm saying.
Aujourd'hui, j'ai plus aucune médication, je vis ma vie, j'ai refait ma vie, j'ai rencontré une autre personne extraordinaire avec laquelle j'ai eu un autre enfant, puis je vis ma vie à chaque jour.
Alors, le message qui est important ici, je crois, c'est si vous avez une idéation suicidaire, n'hésitez pas. Les ressources sont là et je sais que c'est pas nécessairement facile de faire cette étape-là, mais il y a vraiment de l'aide qui vous est disponible.
The way your body reacts can be conditioned, just like you're conditioned to, as a soldier, to respond a certain way with your weapon to a stoppage. You can condition your body to respond a certain way to a elevated response. There's lots of tools available, and that's good because not one cure, one size fits all.
It's no different than when my car starts making a funny noise. If I leave it, it can turn into a major disaster. I could be stuck on the road someplace because things fell out. If I go to the experts, get it fixed, get it looked at, I can go and I can cope.
Je dirais qu'aujourd'hui, j'ai vraiment une belle carrière. J'aurais aimé peut-être avoir eu ces problèmes-là avant ma carrière militaire, mais malheureusement, c'est arrivé durant. Puis je remercie les Forces canadiennes, dans le fond, de m'avoir supporté dans tout ça, qui fait en sorte qu'aujourd'hui, je suis ici en train de partager mon histoire dans le but d'aider les gens qui vont passer peut-être à travers les mêmes histoires que moi.